All right. Hello, everyone. Hello, everyone. Great. Thank you, everyone, for coming, and thanks for folks joining online. Today, it's my great pleasure to introduce our speaker, Dr. Anna Diez Roux. Dr. Diez Roux is director of the Urban Health Collaborative and a distinguished professor of epidemiology at the Dornsife School of Public Health at Drexel University. And from 2014 to 2023, she was the dean of the Dornsife School of Public Health, originally trained as a pediatrician in Argentina. She completed her public health training at Johns Hopkins University School of Hygiene and Public Health. And Dr. Diez Roux is internationally renowned scientist for her research on the social determinants of public health and the study of how neighborhood physical and social environmental environments affects health. And her research area includes many, including the social epidemiology. So for the students, you might already read Dr. Diez Roux' paper on the overview of social epidemiology, and also including urban health, the topic of today, health disparities, gene environmental interactions, environmental health effects, etc., using multi-level methods and complex system approaches. So she's currently the principal investigator of the Wellcome Trust-funded grant called SALURBAL, and the NIH-funded Drexel Center on climate change and urban health. And she has many awards. So I'll just name a few, including the Wade Hampton Frost Award from the American Public Health Association, the award for the outstanding contributions to epidemiology from the American College of Epidemiology, and the Rothman Career Award from the Society for Epidemiological Research. She's also an elected member of the American Epidemiological Society, the American Academy of Behavioral Medicine Research, and the National Academies of Medicine and National Academy of Sciences. So without further ado, let's welcome Dr. Anna Diez Roux.
Thank you very much. It's a real pleasure to be here, visiting the Yale School of Public Health and learning about all the exciting work on climate change and health that's going on here. Look forward to learning and sharing with all of you. So today I thought I would do, oops, am I pressing the wrong button?
So you might.
Oh, okay. Okay.
Yeah.
Oh, there we go. Okay, so today I thought I would do three things. Frame a little bit why an interest on cities is fundamental to public health and also to understanding the impacts of climate change and acting on climate change to prevent the health impacts of climate change on health. I'll share with you work that we've been doing as part of a large international collaboration called SALURBAL, Salud Urbana América Latina, Urban Health in Latin America, as sort of a foundation for new climate change-related work that we are just launching, and tell you a little bit about our plans for SALURBAL Climate, which just launched a few months ago, as well as for our very new center on climate change and urban health that was funded also a few months ago by NIH. And hopefully generate some discussion about what we need to do to address effectively the impact of climate change in urban areas. So probably it's not necessary to remind people in this audience why cities are important to public health or to understanding the impacts of climate change on health, but I just wanted to say a few words about this. First of all, as you all know, urban environments continue to grow and have a major impact on climate change. It's estimated that by 2030, over 2/3 of the world's population will live in urban areas, but most importantly, the majority of the growth that we're seeing will happen in lower and middle income countries, is happening in lower and middle income countries. As you may know, cities contribute a large proportion of global energy-related carbon, but can also be places where we can find policy solutions that make things more efficient and that actually reduce the climate impact. And so urban policies present major opportunities for climate mitigation as well. Urban areas are also especially vulnerable to the adverse effects of climate change. And this is because many urban areas are coastal. They're often, particularly, especially in lower and middle income countries, they're often characterized by rapid growth, poor planning, high density, inadequate and precarious housing, poor infrastructure. They have very high levels of social and health inequality. Urban areas are very diverse in race and ethnic background and social class, and that creates a lot of sources of inequality. And for all these reasons, adaptation policies are obviously very important in cities as well to mitigate the adverse effects of climate change that has already happened. And last but not least, urban policies can support both mitigation and adaptation. Some of them are actually can address both things sort of at the same time and have, health and environmental co-benefits. And so for this reason, robust and actionable evidence showing the impact of things that many cities are already doing, showing the impact of these things on health and the environment is important to continue to advocate and also to support action. So for all these reasons, it's important to think about, to focus on urban health and the impact of climate change in cities. And I want to spend a little bit of time telling you a bit about an urban health, a global urban health study that has been in place for several years now. We were funded back in 2017, originally by the Wellcome Trust as part of a big initiative they had called Our Planet, Our Health, which was not explicitly climate focused, but it was focused on environmental sustainability. And so a number of the foundational work that we've developed as part of this initial funding phase is what we'll be leveraging to do the climate related work. So I want to spend a few minutes telling you about what we've done so far in Salud Urbana as an example of a really, from my perspective, very special multi-country collaboration, which I think we really need to do more of. And I'll hopefully that will become clear as I tell you a little bit more about the study. So the study has the ambition, Salud Urbana, of creating the evidence base needed to make Latin American cities, but also other cities, because we think that there's a lot that can be learned from Latin American cities that is relevant to cities worldwide, to make these cities healthier, more equitable, and environmentally sustainable, with the idea that these three things are interconnected and entwined. Also, and this was new, certainly for me as a researcher, I have led a number of projects, but it was very rare that the funder required an explicit objective to engage policymakers and the public. And so this was actually part of the grant from the very beginning. I think we're seeing more of that now. Certainly NIH is doing more of that now, which is something that was not very common before. And so engaging policymakers and the public in a new dialogue about urban health and urban sustainability and its implications for societal action was a very, very important part of the project from the very beginning. Also, creating a platform or network that will ensure continued learning and translation. So we have worked very hard to engage the region and to engage investigators from the Latin American region in the study in a very meaningful way, so that it's not just about send us your data, we'll analyze it, and then publish papers with it. And last but not least, really, a desire to really respond to the needs of the region, which is characterized by high urbanization and high inequity, among the highest in the world, but also to draw general lessons that could be applicable to other regions. So this is the Salud Urbana team. It's coordinated by the Urban Health Collaborative at Drexel University, Dornsife School of Public Health in Philadelphia, but it includes a number of partners across the region, most of them in Latin America. We also partner with the Pan American Health Organization. And the initial formulation of the project of SALURBAL had four aims. One was to really use observational data to identify city and neighborhood drivers of health and health inequities. A second aim was to do policy evaluation, so to identify opportunities to do natural experiments or quasi-experiments to try to characterize the impacts of actions that cities were already taking in the region. So this was done, we funded 6 of these after a competitive RFA process in several different cities of the region. So it was very focused on partnership between the research institutions in the countries and mayors' offices or other local partners that were actually doing the intervention, but trying to do it, you know, in a rigorous way. We also had an aim that was focused on bringing sort of a systems thinking lens to understanding the drivers of urban health and also the impacts that policies might have. And so I won't tell you a lot about this, but we did employ both more qualitative approaches such as participatory group model building, which is sort of a systems inspired way of thinking about of increasing understanding of the drivers of urban health and what policies might work in the context of complexity, and then some simulation models. I'll tell you a little bit about that because they can connect to some of the climate work as well, including agent-based models. And last but not least, our policy aim, which was really about policymaker engagement. And so really we're really about, you know, science, but also impact and also inclusion of the region in a meaningful way in all aspects of the study. So SALURBAL includes our city universe is all cities of 100,000 or more people in the 11 countries that are represented in the study. So it's not all countries in Latin America, but it's a large proportion. And this figure shows the population of the cities by country: Argentina, Brazil, Chile, etc. And what I want to highlight here is that of course we include smaller emerging cities, but also the big metropolis, so that there's a lot of diversity in the characteristics of the cities that are in the study, which is a very, very important fact, it turns out, because it helps us learn more, because it allows us to contrast very different cities. But it also recognizes that we need to, when looking at urban issues, we need to think about not just the huge cities, which is what people immediately think about, Sao Paulo, Buenos Aires, Mexico City, but also thinking about the many smaller cities that are growing rapidly across the region. The SALURBAL data resource, we compiled, working with the countries, we compiled a range of data, including health data, physical and built environment data, and social and economic environment data across all of our cities, 371 cities, but not just for the city as a whole, but also for smaller units within the city, which we call sub-city units. For example, if a city is composed of several municipalities, we have disaggregated data for municipalities, but also even smaller neighborhoods within the cities to allow within city comparisons. And we have, this is of course longitudinal, linkable to other data resources. And there's also a public data dashboard that we recently launched called the SALURBAL Data Portal, where we make available the data that we can make publicly available. And that also includes a number of interactives to help with some of the dissemination efforts. So this is a really has been a huge effort, lots of information. And I just want to highlight, we have 11 countries, 371 cities, almost 1,500 sub-cities, and almost 250,000 neighborhoods. So I want to share with you a few select findings from the study in 4 key areas that are relevant to climate impacts. And these are areas that we will be building on as part of the new phase of SALURBAL Climate to understand better and to also take us in slightly different directions, which I'll share with you when we talk in a few minutes. So health inequities across and within cities, air quality and policy drivers, sustainable transportation and mobility, and temperature impacts on health, as well as flood exposures. So a big goal of SALURBAL was to make urban health inequities visible, to spur action. This is not news that there are health inequities, but the magnitude and presence of these inequities has not been as visible in the region as perhaps it has in other contexts, particularly in higher income countries. So one of the first things we did was characterize health across our cities. And so here you see a map showing life expectancy at birth for men in 363 cities. And one thing that was very striking to us was that there's a huge difference in life expectancy across different cities. And you can see in some cities, the life expectancy for men is close to what it was in Afghanistan at the time. And in other cities, it's close to what it was in Germany. So huge heterogeneity in life expectancy. And it turns out that the social environment, which is a social environment index that the study created, which includes measures of education, crowding, water, and sanitation, no surprise, is the strongest predictor of differences in life expectancy across cities. Now, it wasn't only life expectancy, but also the causes of death differ across cities. And this figure shows proportionate mortality for several major causes of death. Each line, each vertical line is a city, and they're sorted by country, as you can see here. And they're also sorted by one of the causes of death, which is violent injuries, which is this green at the bottom. So you can see here, for example, how for violent injuries, even within countries, there's also enormous heterogeneity in the proportion of deaths that are due to violent injuries. Now, if we sorted by other causes of death, you would also see a lot of heterogeneity. But this is, this is one example. And we found, of course, that several social indicators, social and economic indicators, were also strongly related to violent injuries across our cities. We also did additional analyses looking at heterogeneity within cities and life expectancy. This kind of thing has been done a lot for high-income countries. I'm sure you've seen maps of this, but it has not been done for lower and middle-income countries very much at all. And so we looked at sub-cities for the larger cities, and then we've been looking in more depth at smaller areas or neighborhoods. And just, describing these inequities and looking at select indicators that might be associated with them. And I'll show you later, but this kind of work has got huge media impact in the region, which we were quite surprised by, but I think motivated a lot of discussion. And of course, climate change is operating on top of this inequity already, and which is something that I'll talk a little bit more about when we talk about sort of what our next steps are in terms of looking at the equity impacts of climate change. The other area that I just wanted to share a few findings with you has to do with evidence on air quality and its drivers. So one of the things that we looked at was PM2.5 levels. Of course, we found a lot of heterogeneity. Each dot is a city, and they're categorized by country. So a lot of heterogeneity in annual mean PM2.5. Very high levels of exposure. I mean, even using the old WHO standards, which is when we first published this paper, the new standards hadn't come out yet. Almost 60% of the population lives in areas with levels above the standards. And if you use the newer standard, that's even over 90%. And we also looked at what city factors are related to having higher or lower levels of PM2.5. And we found that there are several policy relevant factors like motorization, traffic congestion, policy amenable factors that are strongly related to higher levels of PM2.5. And in contrast, for example, greater access to public transit was related to lower levels of PM2.5, as was more green space. Now, you may say, well, this is obvious. We already know this. And I think to some extent that's true. But being able to demonstrate this across the Latin American cities also got a lot of attention in the region because it shows that there are things that cities can actually do to impact these very high exposure levels. Another pollutant that we looked at, of course, which has a lot of connections to climate change, is NO2. And of course, NO2, we looked at a variability across much smaller areas because of the spatial heterogeneity, even across small areas in NO2. And so this is examples of neighborhood levels of NO2 in two of our cities, Buenos Aires and Quetzaltenango in Guatemala. Again, we observed, a lot of heterogeneity across neighborhoods, but very high levels of exposure. So of the almost 236 million people who lived in the cities that we studied in these analyses, 85% lived in neighborhoods with NO2 levels above the standard. So very, very high levels of exposure here as well. And higher NO2 levels also linked to traffic congestion and less neighborhood green space, for example. So in thinking about the impact of climate change on these cities, the impact of climate change on these pollutants, but also interactions between things like temperature and these pollutants, of course, become very salient in terms of understanding the impacts and also understanding the health inequities. SALURBAL also had a major focus on healthy and sustainable urban mobility because this is a big issue in the region because of the very high levels of urbanization, but also because the region Latin American region has been a source of a lot of innovative thinking around urban mobility. One prime example is Colombia, for example. Bogota and several cities in Colombia have been at the forefront of thinking about strategies to deal with urban mobility. So, we were very interested that our partners were very interested in this. And so we had a big focus on this. Of course, the region is experiencing very high levels of motorization. I mean, the levels of motorization are rapidly increasing. This is just one example, a 30% increase over 5 years. This has had a major impact in, how urban commuting happens in the region. Anecdotally, when I go back to Buenos Aires, I take a bus that I used to take from my home when I was a resident at a big children's hospital. The ride used to take like 25 minutes. Now it takes like an hour and a half because there's so much traffic, so many cars. And motorcycles have also increased dramatically, especially since the pandemic. And so this is a huge health issue for the region. Traffic-related mortality is a major source of mortality in the region, among the highest rates in the world. And so we looked at the relationship between city features and traffic-related mortality, and of course found that cities with more public transport have lower traffic-related mortality, and higher traffic mortality is linked to more isolated urban development. Again, factors that are policy amenable, and you can start to see sort of the health and environmental co-benefits because the same factors are emerging across analyses looking at environmental outcomes and health outcomes. It turns out that in the region, urban mobility is also linked to health behaviors. We had some intriguing results looking, using some survey data, showing that more time commuting and delays in traffic were linked to worse diets and more depressive symptoms. This also got tons of press in the region. It was a very interesting, I think, way, brings in things that people don't usually think about, how commutes can be affecting behaviors that then relate to non-communicable diseases in ways that you might not have anticipated. As part of one of our policy evaluation studies, and that AIM2 that I mentioned, where we're doing natural experiments, the team in Colombia led by Olga Lucia Sarmiento, who is co-PI of the SALURBAL climate study now with me, they partnered with the city of Bogota to evaluate a new public transportation initiative called Transmicable, which is an extension of the BRT, which is this bus bus fleet, which travels through dedicated lanes, and extension into the outskirts of the city, which tend to be much poorer areas, through a cable car system. And so they did a really nice quasi-experimental design where they compared the neighborhood that received the intervention with a matched neighborhood that was not receiving it at the time, but was scheduled to receive it later in time. And they found that the cable car had a number of benefits, of course, reductions in trip time, but also increased leisure time, something we don't think much about, but that is probably quite important to health, reductions in inhaled pollutants, more physical activity among users, improvements in health-related quality of life, and also reduced perceptions of insecurity and reduced community stigma. And so thinking about, the climate implications of these kinds of things is also, something that is, very important to build on. So this idea of leveraging urban mobility initiatives to to both mitigate and adapt to climate change. We have also used simulation models to build on this, to really try to understand the impact of different policies under various scenarios. Agent-based models are very good for looking at conditional effects. So what happens, if one policy is combined with another policy? They have a lot of challenges, which we can talk about if you're interested in that. But this is one example of an agent-based model that was developed also for the city of Bogota. So it's a pretty abstract model, but informed by certain characteristics of the city of Bogota to make it sort of illustrate sort of an exemplar of a Latin American city to some extent. And we used the model to look at congestion taxes and fare policies, which were two things that the city was actively considering as part of transportation initiatives. And I don't have time to get into the details, but the model allowed us to examine the independent and combined effects of both policies. And major conclusions were that to reduce time poverty among lower SES people, fare policies were needed. Fare policies are expensive, but the cost can be offset through combined implementation of a congestion tax. So this was sort of the bottom line of the results, which some aspects were surprising, but that's because, that's what you expect with an agent-based model, to show you things that you wouldn't necessarily predict. And part of it is driven by the fact that in many of these cities, a large proportion of the population actually walks a lot. So it's very different than US cities, where very few people walk. Well, in these places, a significant proportion of low SES people walk because they have no choice but to walk, and they walk very long distances. And so paradoxically, when you improve, when you do fare policies, you may see reductions in walking time, but that can be a good thing, not necessarily a bad thing, right? It's all a question of balance. So these are some of the nuances that can emerge when you do these kinds of analysis. So thinking about how this can be expanded to incorporate climate change and answer questions relevant to climate change policies is something that we're also thinking about. We've also been looking at health impacts of some climate change-related exposures. Of course, temperature is a critical one that we have focused on as part of the initial phase of SALURBAL through an ancillary study led by Daniel Rodriguez at Berkeley. And we, for our 371 cities, we looked at the relationship between temperature and mortality, similar to what has been done in many high-income countries. Some of you may recognize these kinds of figures that show the distribution, the histogram of the distribution of temperature across days in a year, and then the relationship, the relative risk for temperatures, various temperatures compared to the minimum mortality temperature for the particular city. And so we've created these, we've done these analyses and created these figures for all of our cities, and found, similar to others, that about 6% of deaths can be linked to non-optimal temperatures, temperatures below or above the minimum mortality temperature. The proportion is higher for cold than for heat, primarily because the days at cold temperatures are much more. So it's an attributable risk. So the prevalence of the exposure impacts the attributable fraction a lot. But when we looked at the steepness of the curve associated with cold and hot, we found that the steepness was for the most part, much more significant for hot days overall. So a 1 degree centigrade increase was linked to almost a 6% increase in mortality. Signaling that, as temperatures continue to shift towards the right, we're likely to see significant increases in mortality. Of course, adaptation may kick in to a certain extent, but that's, something to evaluate. But at the same time, there's a lot of heterogeneity across cities. You can see this in these pictures here. Now, some of it is due to the distribution of temperature. So depending on the temperature distribution, the shape of the curve is going to be different. But there are also other factors that may be affecting these, even within similar temperature distributions, that may be buffering or enhancing the impact of heat. And so that's one of the things that we want to look at. We've delved into it a little bit, and I'll show you that in a minute, but there's a lot more to do. We also created, sort of aligned with our, dissemination and strategy, we also created an interactive app where people can, take a look for their city and explore these curves in more detail for their city, including, how many deaths were attributable to heat during X period, or other aspects that they may want to look at. So we did look at some effect modification of the excessive death fraction for heat. And one of the things that we were very interested in is greenness. So we found a little bit, but not a very strong signal. It's something that we want to look at with more spatially resolved data, because this is done at the city level. So we found that for arid climate zone cities, there was a little bit of a signal, confidence intervals are including the null here, but we found a little bit of a signal that higher greenness was associated with a lower excess death fraction. Sorry, this should say excess death fractions stratified by greenness level. There was also some signal that effects were stronger when green space was more distributed, as opposed to when it was all centrally located in one part of the city. This is something we want to look into. This is very important policy-wise, because you can recommend greenness, but where, how should it be distributed in the city? And so some of these cities are quite green because they have green in the periphery, for example, in the peripheral areas, which are not very built up. And so this may be, it's not really telling us much. And we need to sort of look into this in more detail. So one of the things that the Berkeley team has done, actually, because they have led a lot of the exposure characterization on greenness, is developed a large suite of very sophisticated greenness measures that we hope to explore more in the next phase of SALURBAL. We also looked at effect modification by area SES, area socioeconomic characteristics. And we did not find very much, actually. A few signals, for example, higher secondary education in the city was associated with less excess deaths due to cold. But for heat, we didn't really find very much at all. In fact, even some paradoxical findings in the direction opposite to what we had hypothesized. So we really want to look at this at the neighborhood level, because we really think, there's a lot of temperature heterogeneity within these cities. So even that, we're not capturing differences in temperature within the cities, for example, at night, for example, which we know varies a lot. And we're not really capturing effect modification by SES at a finer level, at the neighborhood level. So we think we might see more if we do that. This is at a very high level of aggregation. So in some ways, it's not surprising that we weren't seeing very much yet. We've also looked at ambient temperature and birth weight. This is another area that has received a lot of attention. And these figures show the prevalence of low birth weight by temperature across cities in 3 countries, Brazil, Mexico, and Chile. And as you can see, that in Brazil and Mexico, we saw the expected relationship, higher temperatures, more low birth weight. And for Chile, we didn't see much at all. In fact, the opposite. But you can see the temperature distributions in Chile, of course, are much more shifted towards the left. And this is a huge analysis. It's about 15 million births across 165 cities. So we're continuing to explore this. This shows the result by month of pregnancy. And you can see for Brazil and Mexico, especially in the latter months of pregnancy, the effect seems to be a bit stronger. For Chile, we see nothing at all. So looking at effects of climate change on infant and child health is a huge area, I think, that we need to focus more on. Very recently, and this is work under development led by Josiah Kephart, we're looking at flood exposures and across our cities. This is almost 45,000 neighborhoods in 276 cities from 8 countries. And we observed a very clear patterning by neighborhood SES of exposures to floods, whereas the lowest SES neighborhoods clearly had experienced more floods than higher SES neighborhoods, with a quite remarkable dose response. Actually, I was quite surprised to see this. And we've also looked at, this is all preliminary work, odds ratios of neighborhood flooding associated with neighborhood features. And, we see, of course, the education signal, higher education, less floods. Greenness is associated with more floods. This may have to do with the peripheral location of these cities. We're not sure. We need to explore this. Coastal neighborhoods, of course, a huge effect. And so, we're following up on some of these exposures as well. Distance from the city center, neighborhoods farther from the city center, greater risk as well. And so our next phase is to look at the impact of these flood exposures on some of the health outcome data that we have. So this is just a quick summary of some of the SALURBAL findings relevant to climate change, large inequities in health across and within cities, especially across small areas, pre-existing, which of course will be further. It's very possible they are magnified by climate change and also by climate change exposures and also interact potentially with climate change exposures. Substantial air quality issues, substantial exposures and policy relevant factors linked to levels. Multifaceted impacts of urban mobility on health, and a great opportunity for intervention. Many across Latin America, there's a lot of interest, for example, in electrifying bus fleets as a policy initiative. Many of these cities are highly dependent on bus fleets, and so that has you can think of multiple climate and health connections there as well. So I'll tell you a little bit about what we're planning for the future as part of SALURBAL Climate. And, temperature and floods really as emerging health threats in the region. So these are the things that we're building on with SALURBAL Climate. I also wanted to share with you some of the dissemination work that we do in SALURBAL. This shows data briefs and webinars. So we produced a number of data briefs just describing our data or key aspects of the data, or highlighting problems in the data like mortality statistics, and encouraging strategies to improve. We also did a brief in collaboration with the Ubuntu Center at the Dornsife School of Public Health on race and racism in health data, an underemphasized area, certainly in the region, that deserves a lot more attention. And we also do dissemination webinars in Spanish, Portuguese, and English. We've also done policy briefs, which are more targeted at specific policies, and in-person events. Here's one policy brief on the Transmicable study that I showed you. And, we do a lot of, each of our meetings has a policymaker day in which we engage with the local teams to talk to local officials about the study and what we're finding. And media, as I mentioned, I just wanted to highlight, it's been really interesting to see the things that got traction. Certainly the differences in life expectancy across cities, a simple descriptive analysis got huge impact, as did, the very high NO2 exposures, and also the temperature impacts on mortality and low birth weight also got a lot of attention in the press. So there's clearly a lot of interest in the public in these topics. One of the things we want to do as part of SALURBAL Climate is do more specific outreach to journalists specifically, and we're also even planning some workshops with journalists to facilitate understanding the information and its implications. And we also have we partner with a number of different organizations, intergovernmental organizations, Pan American Health Organization. We've attended, meetings of a network of mayors that PAHO hosts. We've also developed a really great partnership with the Inter-American Development Bank, which is a development bank in Latin America that supports a lot of transportation and housing work. They actually did a documentary on our study, so you can watch it there. And also with other non-governmental organizations like the World Resources Institute, we recently got funding to work with them in a small number of cities to use data. The goal is to put together some data quickly to impact action in a very short time frame. So, which is that study is just about to launch now. So that brings me to SALURBAL Climate, which I want to tell you a little bit about. We were renewed by the Wellcome Trust just last November after a competitive process to continue SALURBAL with a focus on climate change and health. And so our goal is really to leverage and expand, the SALURBAL team, the data resource, and the partnerships to generate new and also context relevant knowledge, which is very important to support action. Support actions to prevent the further health impacts of climate change and also protect from changes that have already occurred, and to build regional capacity for continued learning and action into the future. And of course, this is very aligned with the work that we've already been doing in SALURBAL. And so we have 4 aims, which I'm going to tell you a little bit about. The first aim is to generate locally relevant evidence on climate change and health equity impacts, because locally relevant evidence is as we've seen in SALURBAL, is a powerful driver of action. And there's evidence. There's a lot of evidence that data from the Latin American region is very lacking in terms of climate change and health. What are we going to do? Well, we're going to document the magnitude of exposures, just descriptive information, how many cities, how many people are exposed to heat waves across the region, or how many people were exposed to air, pollutants linked to wildfires over the past X number of years. Descriptive data globally, but also by measures of social disadvantage, for example. So just describing exposures and also looking at health impacts as well, of course. So going beyond heat to also look at floods, air quality, interactions of air quality with other things, wildfires, drought, and storms, and also with a strong equity focus, because inequities are so important in the region. So we're going to we're leveraging and expanding the existing SALURBAL resource and disseminating findings by building on the data portal that we have, and using interactive tools, webinars, and stakeholder engagement. So that's the first aim, which we've already started on. A second aim is to look specifically at mitigation and adaptation strategies. Why? Because many cities in the region are taking innovative actions. Sometimes it's not because of climate change, it's just for other reasons, but taking advantage of those actions that they're already taking to evaluate them. And because we've seen that evidence on policy impact is really needed to support policy change. And so we will be investigating the health and equity impacts of planned and feasible mitigation or adaptation strategies. So things that are already in the works or things that are really feasible in the region, not pie in the sky things, but things that can really happen. And we're going to be using two complementary approaches for this. Health impact assessment in the sense in which it's described by WHO, which is a stakeholder engaged, equity focused, ex ante sort of evaluation of a proposed program or project. And so we'll be doing that in two locations initially, in Santiago and Bogota. Both cities have proposed important urban greening corridor kind of projects. And so the institutions in both Universidad Católica in Chile and the Universidad de los Andes in Bogota are working with their cities on this. So this gives us great depth, and we hope to develop a methodology so that this becomes sort of an exemplar approach that can then be used in other cities. And then combined with that, comparative risk assessment, which is sometimes also confusingly called health impact assessment, but we try to keep them separate. Comparative risk assessment, which is more of a modeling exercise across multiple cities using existing evidence, tried to estimate the impacts of a particular policy like electrifying bus fleets using evidence from other sources. It's a very quantitative modeling exercise. And so, you know, one gives us more depth, the other one gives us sort of more breadth. And so that's what we are planning for our second aim, which is really, you know, about policies. Our third aim, which was not an aim in the prior version of SALURBAL, but which we have made an aim in SALURBAL climate because we did so much of it and it's so important, is field building and capacity strengthening. Because, you know, local perspectives are critical to rigorous science, we think. We think we can't get the science right if we don't have the regional scientists involved. That has been very clear in SALURBAL, I think. And because local researchers are best positioned to influence local policies. And so we do a lot of informal and formal training. In this next phase of SALURBAL, we are formalizing some of the things that we did more informally in phase one, including researcher training, strengthening institutional capabilities to lead and conduct research, and capacity strengthening for policy actors and civil society. This is kind of that workshop on journalists is one example of that. And so we'll be doing this by targeting individuals through funding for early career researchers. We're also launching something we call the SALURBAL Fellows, through which we also hope to engage scientists from groups that are underrepresented. Institutional capacity building, so the institutions, you know, many of these institutions have limited experience submitting and managing grants. And so we support them in many ways for that, and we'll continue to do that as part of the next phase. And also, you know, more societal activities and public engagement. And our fourth aim is similar to the first phase of the project, to support policy action more generally. And you know, ensure that research addresses local priorities, deliver findings effectively, and strengthen capacity among stakeholders to advocate for policy change. So we have a number of strategies that we're using here: information sharing, capacity strengthening for researchers on how to communicate with policymakers, for policymakers on how to understand the data, and particularly their policy implications, and other stakeholders in terms of how to interpret some of the findings, as well as some specific policy and community engagement activities through a bunch of different things. So these aims are, of course, all interrelated and reinforce each other. And we've just got started working on this a few months ago, so the team is really, really thrilled. And last but not least, I want to tell you a little bit about our new center. So it's 10 of, right? Am I seeing that right? There's some glare. Yeah, so a couple more minutes and I'll be done. So I just want to tell you a little bit about our new center, which is very aligned, of course, with SALURBAL, but also builds and expands on it. And so really our ambition here is to leverage the power of cross-city comparisons, not only across SALURBAL, which I've already told you about, but also across work that we have been doing at the Urban Health Collaborative in the United States. As one example, we have a partnership with the Big Cities Health Coalition, which is an organization that brings together the health departments of the 35 biggest US cities. And we've done a number of things with them over the years, including a data dashboard and consultations on various topics. And so we really want to expand the work with them to encompass climate change impacts in these cities and policy implications, but also to think about how all this kind of fits together and how we can learn across the region about impacts and about what works. So our center, which is focused on creation, translation, and dissemination of evidence to support urban policies to address the health and equity impacts of climate change in cities. We have an administrative core, a research capacity building core, community engagement core, which is a policy engagement core, really, in our case. It's really about working with policymakers, some public engagement too, but primarily our community, our policymakers, actually. And a research project, which I'll tell you a little bit more about in a minute. This is a partnership with the Institute for Transportation at Berkeley, led by Daniel Rodriguez, who's also part of SALURBAL, INCAP in Central America, Instituto de Nutrición de Centroamérica y Panamá, and several institutions in Brazil. And it's an exploratory center. As you know, it's a 3-year project that we're really trying to leverage all the strength that we already have in urban health and add to it a climate focus. That's why there's a lot of emphasis on capacity building so that we can bring our expertise in health equity and urban health, learn from climate experts, and think about how we can move, work together to improve the evidence and support meaningful action. The research project, which is led by Usama Bilal, is really just building on some of the data I showed you earlier on neighborhood differences in health to understand heterogeneity in the impact of extreme heat on mortality across neighborhoods in selected cities in 4 countries. And so, we're interested in characterizing not only differential exposure to heat across neighborhoods, but also differential effects. So the effect modification piece. And so we have a number of aims, from examining heterogeneity in effects by neighborhood to looking at the moderating effects, decomposing the impact of differential exposures versus differential effects, and really develop sort of an exemplar or a paradigm that can then be applied to other exposures and other cities. Last but not least, this is sort of our ambition with both of these projects, SALURBAL Climate and the CCUH, the Center on Climate Change and Urban Health. We want to deliver data and evidence that's locally relevant. We want to support policy evaluation, capacity strengthening, and last but not least, meaningful policy impact that bridges the Americas. And that's it. Thank you so much for your attention. I look forward to your comments.
Thank you so much. So because of timing, I think we have 2 very quick questions. So if any students have any question, please feel free to raise your hand. We do have a lot of questions from online as well, but due to time, we'll just pick one.
Okay, sure,
So,
go ahead.
Anyone want to ask? Yeah, please.
Well, thank you so much for this insightful information. And well, I am not actually doing a research, a literature review about how the green space impacts child obesity. And you just mentioned that we should pay more attention on the cities. And I may misunderstood, but you mentioned that the cities might be isolated by roads or
I think I may have said that the green space is on the edges of cities. So it doesn't necessarily mean that there's a park nearby where people live. So I think thinking about the distribution of green space, I'm not sure if that's what you're referring to, but that's what I recall. Sure.
So there's multiple questions online. I'll just pick one from Freddie Morgan. Greetings from Peru and congratulations on presentation. What would be a proposal for sustainable transportation that would improve air quality in Latin America, knowing that each country has its own characteristics?
What would be a sustainable? You want my opinion? Get rid of cars. That's my opinion. As much as possible.
That's a quick one. Then maybe take another one.
Yeah, sure.
So, very impressive work from K-9. She's asking about the publications of SALURBAL is both in English and some in Spanish. She's asking pretty rare for journals to facilitate the publication of journal articles in multiple languages. That
Yeah, so that is a big challenge. So, you know, there's a lot of pressure, of course, to publish in the top ranked journals, which are in English. So this is something we've discussed in the study a lot about where should they go, particularly for junior researchers. And there's no easy answer. I think over time, we will see more journals in other languages. Unfortunately, I think right now it's still the case that a lot of the work has to be done in English. We translate, our meetings are multilingual, and we do a lot of things. All of our dissemination is in Spanish and Portuguese. But a lot of the publications, we have published some things in Spanish, and certainly the briefs are all multilingual too. But scientific publications, that's still an issue, I think. Yeah.
Thank you. Thank you so much. Thanks again. And for students, do not forget to sign the sheet. And thank you all for joining online. Thank you.